So I'm going to now pass it on to Samiya, and she's going to speak about another element in the framework which I just went through, which is transparency and continuous communication. Thank you.
Thank you,
Samiya,
Sume. Hi, everyone. So as Sume mentioned, my name is Samiya Adbi, and I am located here in Toronto, and I acknowledge that the land I'm on is the land of the Mississaugas of the Credit First Nations, the Hattushanis, the Huron-Wendat, and that this land continues to be a place where many First Nations, Métis, and Inuit people from across Turtle Island gather. And I also would like to bring to mind as a hijab-wearing Black Muslim woman in North America, the very recent incidents of Islamophobia and racism that has occurred in New Zealand. And that is front and center in my mind as I do this work around decolonizing public health and health equity and organizational change. So just wanted to share that before we jump right into transparency and continuous communication. So as one of the pillars that the content areas for process change that Sume has been talking about is this idea of transparency. And one of the best ways to ensure transparency is continuous communication. And this is important because to be something that happens across the board, and should not be something that happens when change is already being experienced. So obviously, the earlier that we're able to communicate the potential change, the better it is for people. It's not sufficient for folks to be for it to come to them as an announcement or an after fact. Am I able to move to the next slide, or? Perfect. Thank you so much. So in the next slide, we are just talking about what do we mean by communication as it relates to public health. So in the Canadian Core Public Health competencies, communications is defined as it involves an interchange of ideas, opinions, and information. And this comes in very different dimensions. It includes both internal and external exchange, both written, verbal, nonverbal, as well as listening skills. And this includes computer literacy and providing information to different audiences, working with the media and social marketing techniques. For our particular interest today, we are going to be focusing on internal organizational communication. And also I just wanted to share that according to BHAC's Scale Online Glossary, communication is defined as skills required by public health professionals to transmit and receive ideas and information and to and from involved individuals and groups. So it's to and from as well as the idea of transmitting and receiving information. Next slide. Perfect. So these are some of the key messages that we will be going through. Obviously, there's a lot of different strategies that one can use to ensure a transparent and accurate communication. But these are some examples that were collected by Berkeley Media Group, Studies Group, and this is the 7 things an advocate should know when communicating about health equity in particular. So we're going to go through each of these 7 dimensions, and we will try to then have a bit of a discussion to see what people are using or have used in the past, and we'll open it up for a little bit for to hear from folks on the webinar. Next slide. So it starts with this idea of, as a tactic, creating a sense of urgency. And this idea is to really push people out of their comfort zone. So why change now? And to kind of make a case that the status quo is more dangerous than unknown. People are often comfortable with the status quo, so we have to make the status quo uncomfortable. And we're going to use a good example of seeing how, creating a case of urgency has been used, at least in Ontario, as a tool or a tactic for communicating health equity. The next tactic on the list is this idea of communicating the clear vision. Clear vision and objective using a variety of communication channels and vehicles to articulate the new vision and strategies for achieving it. So this idea of keeping communication at the forefront, keeping it on the agenda all the time, and the idea is the more we are able to clearly articulate the messages of health equity and keeping it on the agenda, it actually gives people not only an opportunity to buy into the goals of the health equity initiatives that we're trying to implement, but also it gives people more opportunities to shape the strategy and the messaging as this is happening time and again. So an interesting concept that has been used in health equity is the idea of the rocket pitch. So it's a variation of the elevator pitch, which is an opportunity for public health professionals and those who are working as champions to make organizational change in health equity to develop the skills to articulate the ideas of health equity in a very concise, quick manner in plain language that anyone in the organization can understand and hopefully buy into. The third thing on this list is making rational and emotional case for change. So this idea of winning hearts before minds and making sure that we are using a mixed method approach, and we are not only using data when we are communicating about health inequities, but also we are using stories and maybe arts and other forms of communication is proven to be something that provides, that is met with success. So this idea of advocates also being aware of how the messaging makes people feel is important. We talked about the idea of creating discomfort, but we also need to be strategic about how to use that discomfort in a way that does not alienate people and move them farther away from our goals. So how do we make sure that people do not feel they're cornered and then become on the defense? So using it in our language in a very strategic way that we are able to gain buy-in from people who are decision makers and the people who are implementing the change is very key. Next slide. The other thing that is on the list is this idea of recognize how a message are interpreted and modified at different levels of organization. So what we're talking about here is making sure that we are able to make sense of the message across the board. And here is where what Sume was talking about around the use or the importance of the middle managers as folks who are in between, who are able to translate and transmit information as it comes down from senior leadership, but also take up the concerns for staff and other members to create this space for active engagement. It's very important that when communication is happening, we talked about continuous communication, that also we're able to create spaces for feedback. And this communication is not a one-way communication of communicating down to people who are we're hoping to implement the change, but also continuously creating space for feedback and also challenging perhaps or changing some of the things that are being put forward. So this idea of providing multiple opportunities for individuals to come together to share, to understand who are the recipients of this change, and also for senior leadership to really invest in the change conversation. And this comes in both verbal and nonverbal communication, in both formal and informal setting. We often talk about the peer communications. We talk about the lunchroom conversations or the water cooler conversations. These are as important as the written memos and emails that are being sent by the CEO and the president. So what is actually happening peer-to-peer on the latter conversations is as vital as the other more formal ways of having the conversations. Next slide. So there's three more things that I wanted to touch on, and this idea of the repeating health equity message. So reiterating it across the organization, so then that it does not become a siloed or message that only the SDOH, the social determinants of health nurses, or the health equity working group or the health equity lead is championing, and they're talking in a chamber by themselves. It's important that the message is reiterated not by the same people, but it's across the organization by different people and in different ways. And for sure that it becomes part of the larger communication strategy, that this does not become the one-off, yes, it's the health equity folks that are talking about it. So really thinking about creatively weaving in, into all activities, and also the idea of making it a movement, building a movement for social change in the organization, not as a standalone initiative or a project. And what happens when when there's an opportunity for folks from different parts of the organization to contribute, then there is an opportunity to ensure that there is buy-in. The next two pieces are really important for creating accountability. So to disseminate the information about progress. So how well are we doing? And this is where we say both internally and externally. And when we actually share information about our progress externally, what that means is it creates room for accountability inside the organization. So are we actually living up to our promise? Are we doing what we're saying we're doing? So that is a good strategy, if possible, to communicate externally as well as internally. The last point here is around benchmarking against other organizations. So as we approach this work, we often look at other organizations that are in similar positions and find out how are we measuring up, how are we doing, as opposed to so what this is just, it provides an opportunity for both senior leadership and staff to understand what is the standard, what's the real world standard, and also perhaps what are some lessons learned from other organizations who are going through similar change. And if we are avant-gardes and we are the ones, if our organization is the one that is leading the change, then this is where that idea of sharing the information externally to support other organizational change processes comes in handy, but also recognizing within the field are there, so we know that, for example, in social sciences and maybe even in the educational or academic settings, a lot of the time they are doing a lot more work around health equity than, let's say, public health. So finding out who else is doing, and even if it's not within our immediate sector, how are other sectors responding and what their experiences are, and how much of their experience is applicable and transferable to public health is important. Next slide. So this is the example that I wanted to share with you, and which is what the Chief Medical Officer of Health 2016 annual report had spoken about public health, using an outbreak approach, and the idea that this approach would create urgency in dealing with public health as we deal with infectious diseases, making sure that we are able to identify the root causes immediately, assemble a response team, address them very quickly, and be able to measure and reduce health inequities in a tangible manner.